Hey guys, this is a session on sedatives and hypnotics. What do you mean by the word sedative and what do you mean by hypnotics? Sedative is the one, these are the drugs which are usually prescribed in the small dose and they usually do not induce sleep. Whereas the hypnotics, these are usually preferred in the higher doses and they induce sleep. So this is the main difference. Sedative does not cause sleep and hypnotics are the one which causes sleep, and these are usually prescribed in the smaller doses and they are prescribed in the higher doses. So this is the main difference between the sedatives and hypnotics. Sedative is a drug reduces the excitement and calms the person without inducing sleep, whereas hypnotic is a drug that produces hypnotics, that is sleep resembling normal sleep. It's usually same as a normal sleep, but it's a drug which produces natural sleep. So what is sleep? Sleep is a kind of rest you take. So it's actually a normal and it's a good one. It's good for everyone to sleep for at least 7 to 8 hours a day, which makes you very active and lead your normal daily life. So sleep is usually of two types. As we know, it's of non-rapid eye movement and the rapid eye movement sleep. The NREM, that is non-rapid eye movement sleep, is further divided into five stages, that is stage 0, stage 1, stage 2 and stage 3 and stage 4. So they are divided into five different subclassifications. Normally about 50% of the sleep is spent in the stage 2. The slow wave sleep includes the three stages and the slow wave sleep includes stage 3 and stage 4. The REM sleep constitutes about 30% of the sleep time and lasts for about 5 to 30 minutes of each sleep cycle, where you remember all your dreams and your brain's activity will be more and your breathing rate will be increased, your heart rate will be increased, and you'll be able to recollect the dreams whatever you have got in this REM, rapid eye movement sleep. So now moving on to brief classification and definition of sedatives and hypnotics. Sedatives. What are the sedatives? Sedatives are the one which gives you the calming effect, which reduces your excitement level and it does not cause sleep. And they are usually prescribed, as I've said, they are prescribed in the small dosage form. Hypnotics are the one which induces sleep and they usually resembles to a natural sleep. It's not a harmful kind of drug, it's usually a normal dose drug which resembles to a natural sleep. If a person does not get sleeps, as we know, it's called as insomnia. So insomnia can generally occur in two types. It can be primary and it can be secondary. So primary is if that person is suffering from any problem. This is normal and it's usually seen in most of the people, like who have some stress, who are into depression or who have a lot of work. So they will be having one or any other sort of problems. They usually don't get sleep for some 1 to 2 days. It's usually a normal one. So that's a primary one. Whereas the second one, it's the one which is creating problem due to the mental condition. It's not a normal one. You have to consult the psychiatrist, so who will give the prescribed drugs and make you the normal, get back into your normal condition. So classification of sleep, as we have discussed, it's of two types. That's REM sleep and NREM sleep. REM is the rapid eye movement and NREM is the non-rapid eye movement, which is divided into five stages. Speaking about the different five stages of NREM sleep. So, stage 1 is where you get from your lying down position to that falling asleep position, where you change your position from your sitting position to the lying down position, to lying down position, so that you'll get into sleep. This is stage 0. You're trying to prepare to sleep. Second stage, that is stage 1, is where your eye movements slowly starts to decrease. your body muscles will get relaxed, and it's around 5 to 10% of your total sleep. You're slowly trying to relax your body. You're going into a unconscious state of sleep. So it's a temporary state of unconsciousness. Third one is the stage 2, where your eye movements starts to decrease still more. The person is arousable in this stage. It's not like he have completely undergone into sleep condition. He's not completely unconsciousness. He might be aroused at this stage. It's around 50% of the sleep. Stage 3, he have been sleeping very deeply. His eye movements have decreased and it's not easily arousable at this stage. Stage 4 is the deepest level of sleep. The metabolic rates have decreased, there is no eye movement, the muscles are fully relaxed. If awakened, he'll be disorientated for some 1 to 2 minutes. He'll be like unconsciousness, he won't be getting what's going around him. So, for some minutes, he'll be confused. After that, he'll be back to normal. The growth hormone will be more in this stage 4, and all your GIT metabolic rate will be less. Next is the REM, rapid eye movement sleep. Here, as we have said, the dreams can be recalled compared to an REM sleep, and your heart rate will be high. You will be able to dream properly, you will be able to divine the things, your breathing rate will be high, and your brain activity will also be high. Second is the classification of the sedatives and hypnotics. As we have discussed, what are sedatives? Sedatives are usually given in the small doses and they do not induce sleep, whereas hypnotics H, so it's usually given in the high doses and it induces sleep. So remember, as sedative is small dose and hypnotics H, so it's usually prescribed in high dose. Classification of the sedatives and hypnotics includes: first is the benzodiazepine. So benzodiazepine mainly is divided into 3 states, that is 3 subclassification: hypnotics, anti-anxiety and anti-convulsant. Hypnotics is to induce sleep, anti-anxiety to reduce your fear, and anti-convulsant is to reduce the seizures or the epilepsy. Hypnotics, the main drugs includes the diazepam, alprazolam and flurazepam. Anti-anxiety drugs are diazepam, lorazepam, and clonazepam, and even the anti-convulsant drugs common are clonazepam, lorazepam, and diazepam. These are the usually prescribed drugs for the benzodiazepines. Flumazenil is the antagonist of benzodiazepine. Remember this. So flumazenil is the antagonist of benzodiazepine. Recollecting again, benzodiazepine is divided into 3 subclassifications. Hypnotics is diazepam, alprazolam, and flurazepam. Anti-anxiety, it includes the diazepam, lorazepam, and clonazepam, and anti-convulsant drugs mainly includes the clonazepam, lorazepam, and diazepam. These are usually the same one. You can prescribe the same drug for anti-anxiety and the anti-convulsant problems. Flumazenil is the antagonist of benzodiazepine. The second classification is barbiturates. Barbiturates can be of 3 types, that is long acting, short acting, and ultra short acting drugs. So for long acting, you can prescribe the phenobarbital. For short acting, you can prescribe phenobarbital, and the ultra short acting drugs includes the thiopentone drug. The third one is non-benzodiazepine, which includes zolpidem, zolpiclone, and zaleplon. So these are the usually drugs prescribed. So remember the mnemonic Z for non-benzodiazepine: zolpidem, zopiclone, and zaleplon. These are the usually prescribed drugs. Other drugs includes the melatonin. So some types of sleep disorders and their treatment usually prescribed. So when there is a lack of sleep, that's called as insomnia. Insomnia can be of 3 types. You might get the transient insomnia or short acting insomnia or the long term insomnia. For these, usually you prescribe all the sedatives and hypnotics. As I've discussed, you have the benzodiazepines, non-benzodiazepines, barbiturates, etc. So what are transient insomnia? So these usually occur from 1 to 3 days, who are usually not getting sleep for 1 to 3 days. Short-term insomnia includes 3 days per 3 weeks. They are usually unable to sleep. Long-term insomnia it extends for more than 3 weeks. Like they are not being able to sleep at all. It might be due to some stress, depression, or any other mental problems. The second one is hypersomnia, that is narcolepsy, where you sleep a lot. It's the opposite of the insomnia. Insomnia, you're not being able to sleep, whereas hypersomnia, you sleep a lot. So for that also we prescribe drug like amitriptyline and amphetamine are the most common drugs prescribed. Amphetamine is usually uh, prescribed. The third one is nocturnal enuresis. Nocturnal enuresis is usually seen in kids. Uh, they usually bedwet. They pee in the bed. They pee on the bed. So if it extends for a longer period of time, like even after 5 years, 6 years, 8 years, 10 years, so for them we usually treat with the tricyclic antidepressants. So these are the usually prescribed drugs for the sleep disorders. So again, recollecting the classification of sedatives and hypnotics, we'll just write it. So we have the sedatives and hypnotics. So first one is, as we have studied, it's benzodiazepine, where it's subdivided into three, that is sedatives and hypnotics. We have the main hypnotics, as we have studied, it has diazepam, alprazolam, and flurazepam, and we also studied about the anti-anxiety drugs, which includes diazepam, lorazepam, and the clonazepam, and also the anti-convulsant drugs includes clonazepam, lorazepam, and diazepam. These usually are same, the anti-anxiety and anti-convulsant drugs. Second one, we studied about the barbiturates. Barbiturates, we had already read about the long acting ones. We studied about the short acting ones and also the ultra short acting ones. Long acting ones mainly includes the phenobarbital, and the short acting ones includes the pentobarbital, and ultra short acting ones includes the thiopentone drug. The third classification is non-benzodiazepines, where we mainly studied about the Z drugs, that is zolpidem, zopiclone, and zaleplon. So these are the Z drugs. Remember these three names. And there are other some drugs like the melatonin can also be included. This was the classification of sedatives and hypnotics. So remember this classification, it's a very important question usually asked for 3 marks or 5 marks for the university examination. So that's it about this video. This is the introduction. In the next video, we'll be studying about the benzodiazepines and barbiturates in detail. So thank you for watching. Please do like the video, share, subscribe, and comment. Thank you.